So, Dr. Rachel Clarke, you are a specialist in palliative care. You've seen the impact that COVID-19 and the way the government handled COVID-19, the impact that's had on the National Health Service. When you heard that Dido Harding has applied to head the National Health Service, what was your response?
I think it absolutely beggars belief. It really does. Out of all the aspects of the pandemic response that have been handled woefully badly by the government, track and trace has to be one of the very worst, which of course was A, outsourced into private hands, and B, headed up by none other than Dido Harding. So she was given initially £22 billion to provide a track and trace service and failed to do so. So the Public Accounts Committee came out last year and said, after spending this £22 billion, it's not even clear that track and trace has had any impact on reducing COVID transmission. Since then, the government's handed over another 15 billion. So that's 37 billion pounds of taxpayers' money being spent on Dido Harding's test and trace. We don't even know if it's effective in reducing transmission. And I just find that an absolutely reprehensible track record. But worse than that, Dido Harding hasn't even had the decency to acknowledge the failings of test and trace and apologise for them and say that she's willing to learn from them. And in the NHS, as with every other part of life, if you're not willing to learn from failures, learn how to do things differently and better next time, you're never, ever going to improve people's lives. So the idea that someone who can be A, demonstrably incompetent, and B, demonstrably a person who fails to learn from their mistakes, in my book, makes them the very worst person possible to run the NHS.
Now, when Dido Harding said that the real problem with test and trace was that expectations were set too high, how do you respond to that?
I'm a doctor who has spent a lot of the last year caring for patients who have died from COVID. I've had to talk to them as they die. I've been with them as they die. I've had to phone up relatives and tell them over and over again that that their loved ones, their family members are dying from this horrible, horrible disease. And I think at the very least, what those patients and those families and all the NHS and care staff looking after them deserve is a government and an NHS who can stand up and hold their heads proud and say, we have done our best. We have tried everything. We've thrown all we have at managing this disease. Now, the NHS can do that. People have given their all, everything they've got to care for patients. But I'm afraid the government has manifestly failed on so many levels, not providing us with PPE, not protecting the vulnerable people in society that they said they would, instead just sending them back into care homes, and not providing a functioning test and trace. That's not wild expectations on our part to expect the government to provide that. Other governments around the world have managed to provide all those things perfectly competently. It's Britain that has a world-beating death toll of over 150,000 people who have died from COVID. And I'm afraid Dido Harding has to be blamed in part for that, because she has tried and failed to run a functioning test and trace system.
What do you think it tells you about the government's, I suppose, attitude to how they've handled COVID-19? Well, as you say, one of the worst death tolls on the face of the earth. About 1 in every 443 Britons have died of COVID-19 since the pandemic began. We've seen the overwhelming of hospitals, of NHS services, the delay of operations, which now the NHS has to pick up the pieces for because of the failure to suppress that virus. We've seen so many people with long COVID. We've seen the economic and social dislocation of having to have this dragged out because they kept delaying lockdown and then reopening without a functioning test and trace system. What do you think it says that someone who was so instrumental to all of that could be in the running for leading the NHS. The government's lack of any sense of not just remorse, but any basic self-awareness of how this has all been handled.
I mean, to my mind, that says two fundamental things. First and foremost, if you're seriously considering handing over the NHS England into Dido Harding's hands, then that means that you absolutely are a government that is ideologically driven and that prioritises ideology, private as opposed to publicly delivered services, above competence. It's very striking that vaccine delivery, for instance, which has been delivered by the NHS, has been an incredible success. But test and trace, which was privately outsourced, has been A, a lamentable failure, and B, has cost £37 billion, or it will do by the time we get to the end of this year. That's a staggering amount of money. That's a third of the entire NHS budget for a whole year. Every hospital, every doctor, every nurse, every bit of the NHS, and still the track record is appalling. So if you're seriously considering rewarding and promoting the person who has run that, then you have to be a government that is ideologically opposed in your heart to a publicly provided NHS. You just don't care about competence and delivery. What you care about above all else is a privately funded and delivered service. And I think that's absolutely striking. The second thing that I think is really significant is this. Every government makes mistakes, of course, and you're always going to make mistakes in a pandemic. What we faced last year as a country was unprecedented. We'd never lived through anything like that in our lifetimes. So to be a government or a prime minister and get things wrong is absolutely fine. We all made mistakes last year. What's really worrying and I think unforgivable is this absolute unwillingness to look the public in the eye and say, yes, we got things wrong. We should have done these things differently, and we're going to learn from it. We're going to do things differently from this point onwards. The idea that a government won't do that in a pandemic, will continue to look the public in the eye and lie to them and say that they did protect vulnerable people, they did look after care homes, there were no national shortages of PPE, and test and trace was a resounding success. Well, that's a series of lies. We all know that. And so the net consequence of that is the public has no faith in the government. We lose our trust in the people who have power over us. And that's a really dangerous and toxic state of affairs. And I think if Dido Harding were handed the job of CEO of NHS England, it would just be the nail in the coffin for any faith or trust that any of the 1.3 million members of staff in NHS England would have in the system and in the government.
Test and trace, disaster. Vaccination programme, stunning success. What's the difference?
Well, I think that Kate Bingham, who ran the vaccine task force, someone I was very critical of initially, and I'm absolutely happy to say that I got that wrong. She has delivered, in one sense, a fantastic range of vaccines. She bought up millions of doses of vaccines that work and are now protecting the British population, and that's tremendous. The other thing, though, crucially, is that this amazing nationwide combination of NHS staff and sometimes NHS staff volunteering on their days off, plus a network of local volunteers giving up their time to help their local community, that network of decency and goodness and going the extra mile is the thing that has translated the buying up of vaccines into getting those vaccines into people's bodies, actually protecting them. So what we've seen with vaccine rollout is this extraordinary communitarian and compassionate example of people behaving decently to each other in order to protect each other. It's absolutely remarkable. And to my mind, that's the essence and the spirit of the NHS, backed up only too gladly by thousands and thousands of volunteers all over the country, helping and doing their little bit to help vulnerable people. And that's magic. And you just do not get that, I'm afraid, in a privately outsourced version of what should be publicly delivered healthcare.
Finally, in terms of what's happened to the National Health Service over the last 11 years under this government, what are your fears about whether Dido Harding takes over or not, if it's Dido Harding, what the future, if the policies pursued over the last 11 years, where this is heading for the NHS?
Yeah, so this is something that keeps me awake at night. And I think a lot of us who work in the NHS, we've seen over the last 11 years, we've seen real terms decreases in the amount of funding per capita that the NHS is provided with. And as we've seen NHS funding shrink in real terms, so we've seen all the performance indicators absolutely go haywire. So the government now, for instance, will try and pretend that there are 5 million people on waiting lists in the NHS because of COVID. That's an absolute downright lie. There were already approaching 4 million people on those waiting lists before COVID ever arrived in this country. And that is a direct result of year-on-year real terms decreases and absolutely inadequate provision of funding for the NHS. Now, clearly that's going to continue under this government. They never mention in a meaningful sense actually properly boosting NHS funds to, for example, the same proportion of GDP that France and Germany provide for health. And I think worse than that, they've clearly got massive top-down plans for the NHS that are very worrying indeed. So just earlier this month, Michael Gove gave a big interview to the Sunday Times newspaper in which he announced his determination to, quote, re-engineer the NHS from the top down. And I think the notion of Michael Gove re-engineering the NHS in a radical way is absolutely terrifying. He talked a lot about data and using big data to improve performance, whereas I would politely suggest that what we really need to improve performance is staff. Staff are on their knees, and they were even before COVID. If we want to help patients, we need more people in the NHS. I strongly suspect and fear that re-engineering is a euphemism for privatising, and I strongly suspect that if this government has its way, it will not be too many years before we have a possibly taxpayer-funded NHS, maybe insurance-funded, but definitely largely privately delivered NHS, and that is absolutely not what I aspire to and believe is the jewel in the crown of this country.